$35. That's the most a covered insulin can cost you for a month's supply under a Medicare drug plan now, whatever the pharmacy shelf says. And the blood sugar monitor, the test strips, the lancets? Medicare covers those too, at 20% after your Part B deductible. Ron kept a drawer in the kitchen he thought of as the diabetes drawer. Test strips, lancets, a meter, all bought with his own cash at the pharmacy counter, month after month, year after year. He'd never questioned it. Diabetes was his to manage, so the supplies were his to buy. That's just how it worked. Except it wasn't. Most of what was in that drawer, Medicare would have helped pay for the whole time. Ron wasn't careless. He simply never knew that the program covering his doctor was also built to cover the drawer.
So what does Medicare actually cover for diabetes, beyond the insulin everyone's heard about? And why do so many people keep paying out of pocket for supplies that are covered? Today, in plain English, I'll walk through the benefits people leave on the shelf. This video covers Medicare's diabetes supplies and services. It does not cover which specific device or treatment is right for you, which is a conversation for you and your doctor. Let's start with that kitchen drawer, because it's the most common miss. Your blood sugar monitor, the test strips, the lancets to draw the drop of blood. These are covered under Medicare's medical side, Part B, as what's called durable medical equipment. After you meet the Part B deductible, you pay 20% of the approved amount. Not full price at the register, a share. People pay cash for years simply because they never ran it through Medicare the right way, or bought from a supplier that wasn't set up to bill it. Then there's the newer tool that's changed daily life for a lot of people, the continuous glucose monitor. Instead of pricking your finger all day, a small sensor reads your sugar continuously and sends it to a device or a phone. And Medicare may cover it. Part B, again, as durable medical equipment at that same 20% after the deductible, if you qualify. The qualifying rules are specific. You have diabetes, and you either take insulin or have a history of dangerous low blood sugar, and you've been trained to use the monitor. If that's you, this is one of the most valuable benefits most people don't ask about. But supplies are only half of it, and the other half is where people miss the most. Medicare covers diabetes self-management training, actual sessions with a professional teaching you how to eat, monitor, and manage the condition day to day. It's covered under Part B with a referral from your doctor, and hardly anyone uses it. People will happily spend on the gadgets and skip the one benefit that teaches them how to use everything better and stay out of the hospital. The coverage reaches down to your feet too, and this one prevents real tragedies. Diabetes can quietly damage the nerves and blood flow in the feet, and a small, unnoticed sore can turn serious fast. So Medicare covers therapeutic shoes and inserts for people with diabetes and certain foot conditions. And it covers foot exams and care when nerve damage is involved. A pair of covered shoes and a regular foot check is a small thing that has saved people from losing a foot. That is not an exaggeration. It's the whole reason the benefit exists. There's also help for the people not quite there yet, those told they have prediabetes, that they're on the edge. Medicare covers a diabetes prevention program, a structured, coached program built to help you change habits and avoid crossing into full diabetes in the first place. It's the rarest kind of benefit, one aimed at stopping the disease before it starts, and almost nobody asks for it. If your numbers are creeping up, this is the benefit to reach for early, while it can still change the ending. And yes, the one most people have heard about, insulin. If your insulin is covered under a Medicare drug plan, your cost is capped at $35 a month for each covered insulin, with no deductible to clear first. That's a real, meaningful cap, and it's been the rule since 2023, so it's not something new you have to wait for. It's already yours. We've done a whole episode just on that cap, so today I'll leave it at don't overpay for insulin, and don't overpay for the drawer either. And Medicare will even help you eat for it. For people with diabetes, Medicare covers medical nutrition therapy, real sessions with a dietitian who builds an eating plan around your condition. And it's a covered service, not a luxury. Between the self-management training and the nutrition therapy, there are two full benefits aimed purely at teaching you to manage well and stay out of the hospital, and both sit almost entirely unused. The supplies get the attention. The teaching, which makes the supplies work, gets skipped. So why does a careful person like Ron pay for years out of pocket when so much is covered? It comes down to two quiet gaps. The first gap is simply not knowing which part of Medicare pays. Supplies like the meter and strips run through Part B as equipment. The insulin runs through your Part D drug plan. If you don't know that split, it's easy to buy everything the same way, at the counter, in cash, and never realize half of it belonged on a different covered track. The second gap is the supplier. These items have to come from a supplier that's enrolled with Medicare and will bill it correctly. Walk into the wrong place and you'll be quoted the cash price as if there were no coverage at all, because for that store, there wasn't. There's a mindset piece under it too, and it's worth naming. People with a chronic condition often carry a quiet belief that managing it is entirely their own burden, their cost, their problem, their drawer. That self-reliance is admirable, but here it's expensive. The system was actually built to share this load with you. Letting it isn't giving up. It's using what you've already paid for through your premiums and keeping your money for the parts that truly aren't covered. Do you have a diabetes drawer of your own? Supplies you've been buying out of pocket? Tell me in the comments what's in it. I'd bet more of it is covered than you think, and other people need to hear the same. It's worth stepping back to see how much is actually on your side here, because diabetes can feel like a lonely, expensive thing to carry. Between the monitor and strips, the continuous monitor if you qualify, the training, the nutrition sessions, the shoes and foot care, and the capped insulin, Medicare is built to share nearly every part of managing this condition. The trap is never that the help doesn't exist. It's that it's spread across different parts of Medicare and different suppliers, so no one ever hands you the whole list at once. Consider this that list. And a quiet word of caution, because valuable benefits attract bad actors. If someone calls out of the blue offering you a free diabetic monitor, brace, or pair of shoes and just needs your Medicare number, that's a red flag, not a favor. Real coverage comes through your own doctor's order and a Medicare-enrolled supplier, never a cold call. So chase these benefits, absolutely, but chase them through your doctor's office, not through a number that dialed you. The coverage is real. The callers promising it for free often are not. So here's what to do, and it's very doable. First, ask your doctor's office or Medicare-enrolled supplier to run your monitor, test strips, and lancets through Part B, not as a cash purchase. Second, if you use insulin or have had dangerous lows, ask specifically whether you qualify for a continuous glucose monitor. It's worth the conversation. Third, ask for a referral to diabetes self-management training and ask about therapeutic shoes and a foot exam, the quiet benefits that keep you well. And use a supplier that's enrolled with Medicare so it's billed right the first time. And if you're not sure what your own plan covers or where to get supplies billed correctly, your state health insurance assistance program, your SHIP counselors, will walk you through it for free. Nothing to sell. Reach them or Medicare at 1-800-MEDICARE. Because managing diabetes is enough work without paying full price for help you've already earned. Ron's drawer wasn't a story about diabetes. It was a story about a covered benefit sitting in plain sight, unused, because no one ever connected the dots. Now they're connected. So tell me below, what have you been buying out of pocket that might be covered? If this saved you a few dollars every month, subscribe. Next, we look at the extra 15% some doctors can quietly add to your Medicare bill, and the one word that decides whether they can. This is general information, not financial advice and not medical advice. And we are not affiliated with Medicare, so always check your own situation and your own doctor first. I'm glad you're here. I'll see you in the next one.